Hello
Uh,
and welcome to Surgery Secrets, where we go behind the scenes to uncover secrets about surgery you won't hear in the classroom. My name's Stephanie, and today I'm sitting down with Associate Professor Liang. Let's get started. Okay, we'll start off with some easy ones. Can you tell us your name?
Rhea Liang.
And what is your occupation?
So I'm a general and breast surgeon.
And where do you work?
I work on the Gold Coast of Australia, which, if you're not familiar with Australia, is the far eastern seaboard.
And what does your job entail?
So I'm a general and breast surgeon. I take part in a 1 in 6 general call roster. So that's all your general on call, excluding major trauma. So appendixes, gallbladders, pus of all sorts, and various other general surgical presentations. So that's the acute work. The elective work is mainly to do with breast cancer. I helped set up the breast cancer unit on the Gold Coast, and it's now one of the largest in our state. Servicing about 350 new cancer diagnoses annually.
And what is your favorite color?
Oh, I pondered this one and I can't think of a favorite color because it depends on the day. So I think it's just easier if I say I like the rainbow.
What's your favorite food?
Oh, that's impossible, but probably chocolate.
And who is your favorite superhero?
I was sitting there thinking, and it sounds terribly trite, but if you expect a Marvel superhero or something, I don't actually watch very much film or TV. But I was thinking the true superheroes to me in my daily work are the nursing staff.
One of my cousins is a nurse, and I can attest to that too.
Yeah. Mm.
Your favorite musical artist?
Um, Again, I don't really have one that you can pick. It's like trying to pick your favorite child. But I have always admired beyond the music, the social activism of Yo-Yo Ma, the cellist.
Okay, yes. And what is your favorite movie?
Like I said, I don't watch much TV or movie. I actually have, I've only started disclosing this in the last couple of years, but I'm actually neurodiverse. I have a condition called synesthesia, which actually makes it really difficult for me to watch things like films in cinemas because I just find it, in a sensory level, totally overwhelming. But even though I don't watch much film, I will give a shout out to my sister, Rhea Liang, and her movie output. So, partway through COVID, she put out a movie called Shadow in the Clouds, starring Chloe Grace Moretz. Yes. And of course, being COVID, no one was going to the movies or anything, but it is on numerous streaming services. So if you get a chance, I can highly recommend it. It's World War II drama, but with a seriously kick-ass feminist bent to it.
Okay, everyone, you've heard it here. Go check it out when you're procrastinating or you have a break on the weekend or something. Go check it out.
Yeah, Shadow in the Clouds by Roseanne Liang.
You heard it here. All right. And what's your favorite organ of the body?
Ah, again, it's like trying to pick your favorite child. I mean, obviously, I spend a lot of my time working on the breast, but that's like not my favorite organ because it gives people, it develops cancers and tries to kill people. Um, I don't think I really have a favorite organ. I mean, on a non-medical level, I would say that people's eyes are always intriguing. Looking at their eyes tell so much of a story.
You
Mm.
do, yes. Um, what about the last book you read?
I mean, it's totally boring. It was a textbook. That is literally the last book I read. But the last book I read recreationally, and this is going to sound terribly nerdy, but I've been slowly working my way again through Richard Feynman's original work, The Physicist, because I last read it when I was in my late teens, early 20s. And I just wondered if I could stretch my brain that far again now.
Physicist.
Um, yeah, Richard Feynman, The Physicist.
All right, so we've passed the quick fire round. Now let's move on to more of our nitty gritty deep questions. So our first question is, who is your biggest influence, either professionally or personally? It's up to you.
It's really difficult. I've had so many amazing influences throughout my life. Obviously, in surgery, I've had, so many surgical mentors who remain mentors, many of them. But I think outside of surgery, my biggest mentor is probably still my father, who is a pediatrician, but also met significant racism through his career and handled it in a very dignified manner. and made changes for those coming after him, even though it was personally detrimental to his own career because of the repercussions. And it's always very inspiring to me that, he could have had a much smoother path if he'd chosen to keep his head down, but he could not, his integrity always shone through. He always had to do the right thing for him, even if it was going to cause a lot of trouble for his career. And for me, that is important. When I apply what I call the deathbed test, which is a little bit morbid, but when you lie on your deathbed, what are you going to be pleased about? And I think when I'm on my deathbed, I don't want to feel that I walked past anything, that if I saw injustice or inequity, that I chose to stay silent for my own convenience, because I already have a great deal of privilege. I am middle class, I have a good job, I will probably never truly suffer, but there are people truly suffering as a result of social inequities of all different types. And part of what we sign up for as doctors, I think, is to advocate for those people.
Mhm. So then growing up, I guess when you saw the efforts that your father took to make future generations' lives easier or better, did that kind of stay with you as you were going through your training as a surgical student?
Oh, yes. So I was, I suspect, a very troublesome trainee because I was noisy and not willing to pipe down about things. There were 2 points in my training where I seriously thought I was going to have to leave for various reasons, because life was being made very uncomfortable for me. But I did push through. And of course, as a consultant, I've had the opportunity to make significant changes and contribute to so significant changes in my own unit, of course, now that I lead you lead as a consultant your own team, but on a wider scale through the Royal Australasian College of Surgeons, I think because the social expectations of community have changed. The things that I said 20 years ago as a trainee that were a little unpopular now seem much more reasonable. The idea that people should have some flexibility in their training, the idea that we should limit people's hours to maintain patient safety, they became less sort of left field, less out there. And so, having already made my name as someone who was agitating for those things, I've had the opportunity to change it for trainees on a wider scale, working with the Royal Australasian College of Surgeons, which has been a great privilege.
Would you say that more recently you've had a memorable moment similar to that, or maybe something else?
Yeah, I mean, memorable moments happen on the daily in surgery, don't they? That they are, you are right at that interface where your action can be life-saving, and people literally bare their souls to you. I mean, they let you plunge a knife into them while they're asleep, which under any other circumstance would be very much aggravated bodily harm. So that's a privilege we have. And when they open themselves up to you, it's just the most amazing privilege, but they're all very memorable moments. Um,
So when I guess situations like that happen, who do you tell when you go home or your colleagues at work? How do you deal?
yeah, I mean, I think every doctor, not just in surgery, you need support systems, and you need multiple support systems, and you use your support systems for different things. So obviously, I have my family, and within my family, of course, I'm a bit spoiled. I've got professional expertise. So, for instance, my husband is a psychiatrist. So, slightly tongue in cheek, he's like, lie down on the couch and tell me all your worries. It's very sweet of him. So I have my family, and I also have friends, both medical and non-medical. I tell you, sometimes you need those non-medical friends to give you a bit of perspective about what really matters in the world. And then I have, Twitter is a fabulous place. If you hang out with the right people, even at 3 a.m, you can find someone who's awake on the other side of the world who can be your sounding board, particularly in the direct messaging, the private messages. And I have the medical education community. So I am a medical educator. I hold a higher degree in medical education, and write and revise teaching courses and direct them and deliver them. Um, But the people who are attracted to do medical education are a self-selected group. They are a group who really want to give back. The way we teach now, there's no power play in it. There's no opportunity for bullying. So the people who go into there with the wrong motivations very quickly duck out. They don't get any gain from it. So the people who do this long term, generally speaking, are like the most lovely people, the ones who really want to give back. And they are constantly a great source of support to me, not just in medical education, but the fact that you've got medical educators as a group makes them great supports and friends to have.
I didn't even realize that there's a separate kind of group of medical educators. I just assume that like surgeons are um, educators kind of in their own way because they're training other students or med students or whatever. But yeah, I just didn't even know that. So I learned something new.
Yeah, well, that has been the traditional problem. So education was seen as something we just did and understood because we had been trained. But that's like saying that someone after finishing primary and secondary school could go back and teach secondary school, just because they've experienced it makes them able to teach it. That's not true. We send them to teachers college to learn how to be a teacher. We skip that step in surgery, and that's one of the reasons, of course, we've had such an issue with bullying and harassment and discrimination, because the poor teaching behaviours of the past have just been passed on as traditional. Whereas if we actually applied the training that most teachers get, for primary, secondary, tertiary education, like even if you're going to be a university lecturer, most places will expect you to learn to do a short course on how to teach or teaching methods, and expect you to maintain your skills in that area. The thought that you are somehow exempt from that just because you're a surgeon or any other medical specialist is a really weird one when you think about it. So it's only in recent years that medical education has become a specialty in its own right, to say not everyone needs to be a medical educator at that level, but in every department you should have a basic level of medical expertise, medical education expertise, and keep the whole department up to speed on what the latest developments are with regard to what's the best way to teach these things.
Mhm. Makes sense. And I can see how it would be helpful in changing kind of mindsets and how things were done in the past for sure. What would you say is one thing about your job that people don't understand?
I think when we're with socializing with lay people, we'll have friends, non-medical friends around for a dinner party or something, and we talk about our work, because it's normal to us. And I don't think lay people realize just how normal it becomes to do the quite crazy stuff we do. So how I said earlier, it's amazing when you stop to think about it, that people give us consent to sink a knife into them while they're unconscious. In any other setting, that would be such aggravated bodily harm. You'd be arrested and put in jail for years. So the fact that it becomes routinized to us, uh, a lot of people don't understand that it's not deadly serious like they see on the TV shows. We talk about, where the good sales are, what we're doing that weekend, and obviously we can refocus on the work anytime. But to us, it's just like anyone else going to their job a lot of the time. Very, very routine stuff.
What would you say is the best part about your job?
I think it's seeing the patients afterwards and the difference that you made. And of course, I have chosen a difficult specialty because in breast cancer, there are no guarantees. Sometimes you do your darndest and it's not your fault. It's not the patient's fault. It's not the treatment's fault. It's just that cancer is a bugger, and is really stubborn. But for the people that you can make a difference for, just the look on their face and the thanks they give you afterwards is just reward in itself. It is. You see people who couldn't even walk before with their terrible hernias, and you fix it and they can walk.
Mhm.
It's almost, I mean, I'm not religious, but it's like Jesus, like, it's like sight to the blind and make the lame walk again. And, it's when you stop to think what we do, it's pretty darn miraculous.
Mhm. Yeah. So then would you say the worst part about your job is when it doesn't go right, or is there another aspect?
Yeah, yeah. People say the worst part is having to tell people they've got cancer or some terrible thing. And I'm like, that's not actually the worst. That's the second worst. The worst is when you've got to tell them the cancer is back. So, they've had the cancer, they've had, surgery, chemo, radiotherapy, it goes on for months or years. And sometimes it's some years down the track when it comes back on their scan. And that's worse because you know the patient by then, you have a therapeutic relationship with them. So it's like trying to tell your best friend that this terrible thing has happened. And it's terrible. You click on the result, you read the result, you click off it again and try and digest it. You click back on it, kind of vainly hoping that it might have changed while you weren't looking. Nope, it's still there. And then you pace around the room, wringing your hands, trying to figure out how you're going to get it across. And then when they come into your room, you get it across as best you can. And it's just, there's a big debate about whether it's professional to cry in front of patients. And I don't know that I've truly blubbered in front of patients, but I have let the occasional tear out. And I don't think that they consider that unprofessional at all. They seem to regard it as a sign that I care, which I do. But I tell you, when they leave the room, sometimes they have to close the door and have a really good meltdown. There's nothing else for it. I think if you stop feeling those things as a clinician, you should probably quit, because then, because what are we in this job if we're not human?
Yeah. I'm sure that you've had a lot of different experiences with patients and had various situations happen at work. But I'm wondering, what's the weirdest or most embarrassing thing that's ever happened to you at work?
Um, I don't know. One of the weirdest things that I had was this poor woman whose job was as an exotic dancer. And she understood that the breast cancer treatment was going to disfigure her breast in a way that she wouldn't be able to be an exotic dancer anymore because that part of your body is very much on show. And she asked us if she could wear her dancing costume one last time as she came into the theatre. And of course, as a woman, I was like, absolutely, to celebrate your femininity for one last time before you can't wear that dancing costume anymore. And I hadn't quite cottoned onto what type of exotic dancer she was. But literally, she came in with this tiny sequined string bikini and a thing in her belly button that flashed, like it had a little light in it, and this huge feather plume, also in bright red feathers. And high heels, really high, and it was amazing. The whole team treated her with such respect. We understood, I think, how meaningful it was to her to come into theatre one last time wearing this. But it was quite a sight as you can imagine, as she was wheeled down the corridor into theatre wearing this get up. Yeah. And unlike what we normally do, because normally we cut clothing off people, and just give them their destroyed underwear back in a little plastic bag. But it was amazing to see the staff, just carefully undress her, carefully took everything down off her limbs and kept everything pristine. I think there was a real sense of respect that we could give that costume back to her whole rather than in tatters. Yeah.
Mhm. We've been talking a lot about physician self care and the importance of support systems and having both, as you mentioned, medical kind of friends and non medical friends to keep you grounded, but then also be various support systems. And you already kind of talked about this already with your support system, but maybe could you tell us and maybe our audience why self care and physician self care is important?
The work we do is hard. It's physically hard as a surgeon, particularly when you're 5 foot tall and weigh 40 kilograms like I do, tiny wee thing. So quite often I'm operating on patients that weigh literally, 3 or 4 times my weight. So it's physically hard, but it's also emotionally and mentally hard. And we're going to live an awfully long time. We train for a long time, med school is long, training is long, and then your career is super long. And I think there is a trend of surgeons, because we're getting healthier and we understand how to keep ourselves healthy, that we're, as a generation, capable of operating for longer than our predecessors. So considering that the average life expectancy in Australia for both men and women is now over 80, that's average. So half of us are actually going to get beyond that. Then I don't know that we're all going to suddenly retire in our 60s. What are you going to do for the next 20 years? So if you're really looking at the longevity of things, you have to look after yourself, both physically, which for me is I do a lot of dance and Pilates, and also see the physio from time to time to stretch all my joints back out from our very unnatural operating postures. But so that's the physical level, but also you've got to keep yourself mentally and emotionally well. For me, that means really focusing on the meaning of my work, because, of course, one of the aspects of burnout is that emotional depersonalization, that you just stop caring. So really being mindful and focusing on that aspect to really get meaning from your work and understand what it is that drives you. But also to learn meditation or some other kind of technique to empty your mind, because otherwise you just get exhausted with so many competing possibilities. It becomes impossible to focus. And always being a learner. So every year I embarrass myself trying to learn something completely new. But, learning something new every year, I think, keeps your brain young. And it can be anything you like. Yeah, new craft, new language, whatever you like. But on another level, of course, it reminds you what it's like to be a learner again, and that helps your teaching. But also it keeps your brain young, just to stretch your brain and lay down a few new neuronal circuits.
I've seen on Twitter that you knit.
Well, crochet.
Okay.
Yeah. So it's a little in-joke, because, of course, one of my early viral tweets, when I think I'd only been on Twitter a few months and got caught short by the viralness of it, but I was called out in a surgical meeting for crocheting. And, of course, the thing about crochet when you're neurodiverse like me is it actually enhances your attention. It doesn't decrease it. The point is, if you sit there like a normal person and watch what's going on, the whole thing is so overwhelming that you can't actually process. So by having something that you're doing repeatedly with your hands, it controls the sort of inflow. But the thing was, the person who called me out said, the knitting lady's not paying attention. And everyone who crochets has this reflexive urge to shout, "It's crochet," because we're so often mistaken for knitters. So it's a bit tongue-in-cheek, but one of my hashtags is the knitting lady, and of course, in brackets, but it's crochet. Right now we're doing teeth for, I don't have a completed one, but right now we're doing teeth for the little people, so the infants who need tooth extractions or dental work done. They have a general anesthetic for it because they're tiny, 2 or 3 years old, some of them. And they always come out of recovery a bit distressed and wanting their parent and all the rest. So we make these little crocheted teeth with them, and it actually gets a little smiley face on the front, and it has a little pocket on the back. You can see it's just pinned there because I'm sewing it on, but it has a little pocket where we put like their tooth, if we've taken out their tooth, and a bravery sticker, and various other little things to keep them happy. Yeah.
Wow. So when you were in school, did you ever imagine you might be crocheting stuffed teeth?
Surgical meeting, yeah. No, not really. I did want to do medicine from quite a young age because I'm in a medical family. So my father, of course, the pediatrician, he's quite well known in the field. He has what's known as an ONZM, which is Officer of the New Zealand Order of Merit, which is the equivalent of a British OBE, Officer of the British Empire. Quite a distinction. So, but he is the, I think, 3rd generation doctor. I'm the 4th generation doctor, because his father and his father before him, like my father, my grandfather and great grandfather have all been medical, as I gather. So you grow up surrounded by these conversations, and I knew from quite a young age that's what I wanted to do. But I didn't settle on the surgical specialty until PGY3. So the system in Australia and New Zealand and Britain, in actual fact, is slightly different to the North American system. After medical school, you do 1 or 2 general years where you rotate around lots of different specialties before deciding exactly what you want to do. So most people don't specialize until the postgrad years.
Mm. And if you weren't doing your current job now, what do you think you'd be doing?
If you'd asked a 16-year-old me, if you don't get into medical school, what are you going to do? Then I think I would have become a teacher. It's still partly my retirement plan, actually, when all is said and done and I'm in my 80s. I'm sure I could still sit as a volunteer in a primary school classroom and just be, the gran in the corner who has time to read to each kid in turn. and get them reading really well. Yeah.
We've come to our last question, and thinking, I guess, about your 16-year-old self again. Um, what advice would you give her when she was kind of maybe considering going to the med school route, right? Because you've had all those influences from your family. What advice would you give her?
I know I was a very socially awkward, very quiet, very nerdy 16-year-old. And I would probably say to her, don't be afraid of that. Like you don't have to be in with the in crowd. You don't need to beat yourself up for not being pretty, not being popular, whatever. It's like, don't be afraid of just being different. There's such a lot of pressure to feel like you have to be a certain way or fit in with a certain way at that age. I'm like, nah, chuck all that out. The amount of wasted energy and wasted headspace I devoted to that kind of worry about not fitting in, not being popular, not being pretty, not doing it the way that anyone else was doing it. I would love to go back and go, nah, just carve your own path.
Well, thank you so much for that advice. And thank you so much for joining us on Surgery Secrets today, Dr. Liang. It
It's
was a
my
pleasure.
pleasure.
And there you have it. Join us next time for another exclusive look into surgery today. Follow us on LinkedIn for new Surgery Secrets episodes, and check us out on Facebook, Instagram, and Twitter. And for more information about Surgery 101, check out our website, surgery101.org. Thanks again, and we'll see you next time.